The inception of Winnunga was from small beginnings in 1988 at the Aboriginal Tent Embassy. The trailblazers of that inception were the late Olive Brown, the late Margaret McLeod, Dr. Sally Creasy and Carolyn Patterson. As an extension of the Tent Embassy, Winnunga then provided a service 1.5 days a week in the Shortcuts building in the back of the old Griffin Centre. Dr. Pete used to drive down from Sydney to run the clinic in the Shortcuts building behind the old Griffin Centre. We moved to Ainslie in 1997 and it was like a palace compared to the Griffin Centre. We moved from Ainslie to Narrabundah in 2004.
Well, it came to my notice firstly when a couple of activists from Winnunga came to my office looking for funds. And they made a very clear case for the health centre. It wasn't a hard decision to make really, because the need was there and it was important to make the decision quickly.
So when I moved to Canberra, there were two reasons. I moved to Canberra as the head of the National Aboriginal Community Controlled Health Organisation, of which Winnunga is a member. So I have a really long-standing commitment to Aboriginal community control of primary health care. And secondly, and perhaps most personally, because I needed a clinic, a health service for me and my family, and Winnunga was it. There was nothing better, and there still is nothing better.
I did work very closely with Julie. We had a great relationship. As I reflect, I do wish I'd done more, but I am pleased with the initiatives that I did pursue, that we were able initially to provide accommodation for Julie at Ainslie. When Winnunga outgrew that with my colleague Simon Corbell, we actually identified this building as potentially available and were very pleased to provide it to Winnunga Nimmityjah.
We started with a budget of $241,000. And now we have a budget of over 12 million. Winnunga's very excited to be providing services to the detainees in the Alexander McConaughey Centre.
With the social health team, we also do work around advocacy and liaison around care and protection issues. We go out to AMC and Bimbri, the Youth Detention Centre. We do a lot of work around clients' social and emotional wellbeing issues, and we also provide a lot of support around drug and alcohol misuse.
Well, we're not just about doctors and nurses and Aboriginal health workers. We run other programs. Healthy cooking group, Elders Garden, healthy weight program, boxing gym, and Mums and Bubs group. We provide a number of community events every year. And we also provide transport. We do a lot, don't we?
Actually, I met Julie 20 years ago in 1998 when I became Leader of the Opposition in the Assembly. I got to know her very well as Chief Minister though from 2001 to 2011 when I was also Minister for Indigenous Affairs. I don't think Winnunga Nimmityjah or even our sister organisation Googin Gulwin receive the recognition that they deserve for the enormous contribution they make to this community.
Can you believe that we started with 5 staff and now we have 80? It's important to see the person as a whole. We don't do body parts. We do comprehensive, holistic primary health care. We look at the physical and emotional side of things, not just the physical well-being, but the social, emotional and cultural well-being of our people. Winnunga provides services to clients from 334 suburbs, 223 postcodes and there's 66 postcodes in the ACT.
Aboriginal medical services are much more than clinical factories. They are in many places, and Canberra is a classic example, where the Aboriginal Medical Service, Winnunga, is the largest and I think probably the longest surviving Aboriginal organisation in the city. And we, because of a holistic model of healthcare, we think that it's not just about whether you're physically well or but we're a whole person, right? That means that organisations like Winnunga are community hubs. They certainly deliver high quality healthcare, but do so much more in terms of support for people, in for example, housing, or people that are in custody, people that are having really difficult times in their life that go beyond just the clinical need.
So a lot of the work that we do is just scratching the surface in that regard. So a client might present to us for one issue, or they might be referred from a doctor or self-referral. And then when we start chatting to that client and building up the rapport and trust, we'll often find there's a whole caseload of issues sitting behind that client. Within that, we'll then work with the client to address these issues and help unravel what's actually caused the client to present here on the day. So for a lot of clients, we find they might be here to see a doctor, but at the same time they might have Centrelink and housing issues, care and protection issues going on at the same time.
So Winnunga is multi-accredited. When the AgPower assessors come on site, they're here for a day. What they have a look at is the doctors, nurses, dental for the sterilisation. So they will have a look at all these different areas within the building, but they will check on perishables. So medicines, they'll check the vaccine fridge, make sure everything's in date. It was easier to achieve our first round of accreditation, I felt, but it is so much harder to maintain it. It's a wonderful thing for Winnunga to have accreditation, but the main reason why I think it's the best reason to have it is for our clients, because then they can trust that they're coming to a service that delivers best practice. Canberra
is a better than average income town, and it's somewhat of an embarrassment that we're not able to provide services to everybody, but Winnunga fills a gap which might not be filled by the General Health Service, and that's why it's so important to see it grow. And I'm sure it will, because I know the people associated with it are working hard and they want to see it grow, and but not just because they want to see it grow, they want to see it provide more service to the community, and that's a great thing.
So we've got a beautiful health centre here in Canberra, and all them people out there should definitely, that runs health centre, come down to Winnunga and have a look at what programs they run, and get out there in the bush and run some of these programs, because I go to the bush, condo, everywhere, and they haven't got these programs, they haven't got what we got here in Canberra.
Well, all the evidence is there, the evidence is in that the best outcomes for Aboriginal people, particularly those living with disadvantage, are produced by Aboriginal community-controlled and managed organisations. And if we didn't have Winnunga and Nimmityjah, then the circumstance of Aboriginal people in Canberra would be far poorer than it is. And it speaks volumes for the role that Winnunga plays, that it is supporting this community in the way that it does. The landscape would be much poorer, and the circumstance of an awful lot of Aboriginal people would be much poorer if it wasn't for the support which Winnunga provides.
The future of Winnunga, I think, is so exciting. And I think we're a permanent part of the landscape here in the ACT and the region.
Winnunga is the heart of our community.
I've been coming to Winnunga for 20 years.
Took all my kids to Winnunga when they were young. Canberra is only an hour away from Kuma, so I travel up here to get all my health services done here in one spot.
Winnunga is where it is today because of all the people that have been involved over the last 30 years, and I'm looking forward to the next 30.